And CNN senior economic analyst Steve Moore, who used to advise the Trump campaign, and Andy Slavitt, once the acting administrator for the Centers for Medicare and Medicaid Services. He managed the Affordable Care Act in the Obama White House. You guys are numbers guys, so let me throw a few out there. We had the CBO score that came out yesterday. 22 million more Americans, it says, will not have health care in the next decade under the current Senate plan versus what is current law, Obamacare. Also said $321 billion will be reduced from the deficit, so conservatives like to hear that number. But, Stephen, one of the big questions is how is this going to lower the cost of health care in America? We've heard from both conservatives and moderates saying this bill doesn't get the job done. And it's not just premiums, it's the out-of-pocket cost that has a lot of people concerned. People may pay less for their insurance, but they go to the doctor and their treatment, they're having to pay out of pocket. They're going to pay more for deductibles or more for the co-pays. What would you do, or what would you advise these senators do to make this bill more palatable?
Well, part of the problem, by the way, with Obamacare is that people are actually paying higher premiums and higher deductibles. So, you know, you're essentially under Obamacare paying more money for less insurance. So that's been a catastrophe. And I have to say that I think one of the things that's misleading about this CBO report is it assumes that we're going to be fine if we do nothing, but we're not. I mean, we see week after week that Obamacare is melting down, and there won't be in 10 years there won't be an insurance market left. Nobody's going to have health insurance if we don't fix this. Now, Republicans have a big problem with that 22 million number because it certainly looks like a big sore thumb in this bill, and they're going to have to convince American people that they're going to bring those costs down, and the way to do that is through more competition, allow people to buy insurance across state lines, do medical malpractice liability reform, more transparency in pricing, more high-deductible policies that lower your premiums. Things like that will bring down costs, and perhaps as much by 30 or 35%.
Andy, what's your thought?
Well, I think the big struggle that the Senate has right now is based in policy. Democrats generally want to push health care policies to cover more people. Generally speaking, Republicans want to push down cost. This bill does neither. This bill causes people to lose coverage and makes the coverage more expensive. So the problem that McConnell has isn't a political one. It's a political one born out of the fact that this bill is really not fixable. I've been in health care in the private sector for 20 years. I ran the ACA exchanges, so I learned a little bit about what it's like inside. Know enough to know that this is not something that can be fixed from tweaking a few things.
So when we look at 22 million fewer people who would be uninsured under the current direction that this is headed, Andy, do you think, though, part of that could be people who choose not to get health insurance?
Well, look, I think let's just look at a couple ways. First of all, let's stipulate that nobody can predict the future. And if it's not 22 million, if it's 18 million, it's 15 million, it really doesn't matter. Conclusion's no different. There's a lot of people that are going to lose coverage. Most of the people that lose coverage in this bill lose it because they lose Medicaid, and Medicaid goes away. So these are low-income people, or their kids. They lose coverage. And then the second reason is because the cost of insurance spikes, particularly if you're over 50, and the tax credits go down. So what the CBO says is insurance becomes unaffordable, and low-income people essentially stop being insured in this bill. That's the principal reason. I'm sure there's a little bit of an effect of some young people that wouldn't buy it otherwise, but that's not the real issue. The real issue is Medicaid, and the real issue is people over 50.
Stephen, one of the biggest criticisms is that this is a huge tax cut for the wealthy at the expense of the middle class or the lower income people. In fact, the Tax Policy Center analysis found those earning $5 million or more would get an average tax cut of nearly $250,000 in 2026 under the current GOP plan. Those earning $875,000 a year would get an average tax cut of $45,500 a year. Does that make sense to you?
Yeah, one of the worst features of Obamacare people forget is this huge tax increase. I mean, people forget Obamacare was one of the biggest tax increases in American history. It was essentially a big redistribution plan. And our analysis at Heritage Foundation shows that those tax increases had a very negative effect on the economy. They reduced employment. They had a very negative effect on investment. I mean, if you want more business to invest, why would you tax business for investing more through the capital gains tax? Why would you, if you want insurance to be cheaper, why would you put a tax on health insurance plans? If you want better, innovation in health care, why would you put a tax on on things like new drugs and vaccines and medical devices. So this is one of the best features of the bill, is getting rid of those tax increases. I think they'll help the economy a lot, and I think they'll help the insurance market. But I just wanted to go back to this main point, because I think it's the central point of disagreement. This plan Republicans are talking about will reduce the cost of health care because it's going to increase competition. It's going to increase the amount of choice that patients have in terms of buying their care. One of the biggest problems I've always had with Obamacare is it has all these essential benefits that, so if you can't buy a basic health plan, you have to buy essentially a Cadillac plan that covers for 25 or 30 different kinds of services that many Americans, A, don't want, and B, can't afford, because as you just heard Senator Cruz say, the average family is paying $5,000 more for health insurance, and if you're only earning $40,000 or $50,000 a year, you can't afford that.
According to the CBO score, though, on this latest bill on the GOP side, it is the middle class, and it is the low-income people, and perhaps the sicker people with pre-existing conditions that could be negatively affected by the GOP plan. Obviously, the GOP plan could still change, as there aren't the votes to get this plan passed just yet. Stephen Moore, Andy Slavitt, we got to leave it there, guys. Got to leave it there.
Okay.
Thank you very much for joining us.